Welcome to the Beauty Talk podcast, where we bring you the latest insights, trends, and expert advice in the world of beauty, aesthetics, and wellness. I am your host, Veronica Perez, and today's episode is brought to you by Skin Beauty Institute, where the next generation of beauty professionals is trained to master their craft. Today, we have a very special guest, Christine McMacken, and Christine is a board-certified family nurse practitioner with an incredible background in aesthetics, regenerative, and functional medicine. From working in Hollywood as a makeup artist to becoming a leader in the medicine or in the medical spa industry, she is here to share her knowledge on the science of beauty, longevity, and wellness. Get ready to be enlightened with this incredible conversation. All right, Christine, thank you so much for being here today, for giving us your time. And I am absolutely thrilled to interview you today because this is going to be so powerful, and I just can't wait. I can't wait. So, Christine, just give us a little bit of your background. Let us know where you're from, how you even started into this. Give us a little bit about your journey.
So I wanted to first off say, Veronica, I'm very grateful to be here. I appreciate you having me on your show and giving me a platform to educate your viewers. I'm from Boston. I live on the South Shore. I have a long history in art, aesthetics, regenerative medicine. My first degree is as a art history and fine arts major from Columbia University. But I was always a young girl who loved art, loved makeup, was attracted to anything that was just beautiful and aesthetically pleasing to the eye. The girl that did everyone's makeup for prom, everyone's hair for all of our dances. And after I graduated with my degree in art history and fine arts in 1998, I went on to aesthetic school at Elizabeth Grady's School of Aesthetic and actually graduated from their first ever medical aesthetics program in 19. I'd always had a dream of moving out to California to just work as a Hollywood makeup artist. So before cell phones, before navigation, before anything, I just got in my car with a giant atlas and drove across the country to Southern California with no plan or no idea of what I would do, but I just believed in myself and knew I would figure it out. And I did. And I have a deep appreciation for being in California in that time, kind of like before the internet, before cell phone, when you could really just get by on who you were, like your word of mouth, your honor. I walked right on to Paramount Studios, took a class there, their studio makeup academy course. And from there, just started working and getting small jobs, small movies, little TV shows, commercials, and then just worked there for a long time. I was a makeup artist almost 10 years. Two experiences which led me to transition from just doing makeup to going into nursing was I was working on a movie called The White Room, and I was the makeup for that movie. And there was a woman, one of the actresses, who was in a abusive relationship at the time. So she would come to set earlier than everyone else, so I could do makeup on her to cover bruises, really, to cover bruises and marks from an abusive relationship. And we never really talked about it, but it was through our time working together where, over the process of the few months of the filming and her coming in earlier, and just through my ability to, touch her, and for her, as those months went on, to slowly, not be flinching from touch and, embracing the touch of another person and seeing herself without those bruises, without those marks, I started to realize that, the transformative power of makeup. And she actually went on to leave that man. And it was like everyone from the movie set, we all, we kind of had an intimate, so great story. And then there was another girl, another young woman, an African American woman who was in a fire when she was younger. And so half of her face, the pigment was burnt off. And so I worked with her, through doing um, reconstructive makeup and corrective makeup, on a set of a movie to even out her skin tone, create lashes, create eyebrows, and give her a sense of herself, like her identity. So when she looked in the mirror, it was, she recognized herself. She recognized the wholeness of the woman that she was. And I realized at that point, like, if I could have this impact on people just through a simple makeup brush, helping them rediscover ownership of their own bodies and their own sense of self. Imagine what I could do, through nursing, through cosmetic surgery, through reconstructive surgery. So that's how I actually transitioned from makeup into going into nursing. And I knew when I went into nursing and got my nursing degree that I I knew I wanted to work in cosmetics. I knew I wanted to work in, reconstructive. That was, that's been my whole field as a nurse. And I had, a wonderful opportunity of doing a residency at Georgetown University Hospital in DC, working on their limb salvage unit, which is exactly what it sounds like. That's where I developed my fondness and interest in wound care, because it was exactly what it sounds like. Trying to help, diabetics, people with vascular issues, not lose limbs, which they would eventually, lose their limbs, and us, caring for them, post op. And then after that, I was able to work the Austin Weston Center, which is actually the oldest freestanding cosmetic surgery practice in the country. It was way ahead of its time. It was incredible. It was a mini hospital purely for cosmetic surgery. We had our own post-op, our own pre-op. We had five operating rooms, five plastic surgeons, anesthesiologist on site. Like, it was an amazing learning experience, working the OR and assisting those cosmetic plastic surgeons with their surgeries. And I feel as any injector, knowing what the anatomy looks like underneath the skin makes you a much more prolific injector. So, just on a side note, I would recommend to any injectors out there, anyone working in aesthetics, if you don't have the opportunity to assist or work in an OR, like, definitely take a cadaver course, because really learning and seeing what the ligaments, the tissues, the muscles, the structures look like under the skin, and how those structures affect the skin, is going to make your results that much better and make you that much more sophisticated as an injector. Um, and then, just as someone who is, interested in always growing and learning, I, wanted to go on and get my degree as a nurse practitioner, because that would just allow me, more autonomy to work the way that I wanted to work within the world. And I became a family nurse practitioner, and and then started my own aesthetics practice. And I did that for years. I was the medical director of, two med spas. I supervised the nurses and the estheticians who worked underneath me. We did all your beauty treatments, that you hear of. Yeah, we had all of our neuromodulators, our Botox, our fillers, our skincare, our hydrofacial, etc. But I realized about 5 years ago that if I really wanted to help my patients to age the way they wanted to age and to live a life full of health and vitality, a vibrant life, I needed to, understand the aging process, the root cause of aging. And so that's where my interest in functional medicine started. And that's what I've really been practicing since then: functional medicine and aesthetic regenerative medicine.
Oh my goodness. Well, thank you so much for sharing that incredible story. And now I can totally see where your passion comes from, and also your thirst for continued education and getting to even further and deeper into what your passion is. And I mean, what it really sounds like is just helping these women come back to themselves, which I think is something that is so, so powerful. Just to kind of piggyback on what you just recently said, I know just like myself and many of the people here in the audience, can you give us a little bit more information about what functional and regenerative medicine really is?
Yes, absolutely. So all the nurse practitioners in our practice are family nurse practitioners. We are all board certified by the American Academy of Nurse Practitioners. We have all worked as primary care providers. We have all worked in the emergency department. We have worked inside the prison system. So we have a deep knowledge of traditional Western medicine and has successfully practiced as traditional medicine practitioners for decades. And through that, we have also come to realize the limitations of Western medicine. That if we want to offer our patients and ourselves not just a long life, but a healthy life full of vitality, vibrance, energy and wellness, we needed to move beyond the barriers of traditional Western medicine. And that's where becoming functional medicine providers came in. And functional medicine is about understanding root cause. We're not just interested in the symptoms and masking the symptoms, where we want the origin, we want the root cause. And we also understand that the human body is a beautiful interwoven system of systems. And there's not one system in our body that functions independently from another system. So if there's dysregulation, if there is disease within one system of our body, it's going to affect every other system within our body. So we look at the patient holistically and we treat every system in the body to bring balance, to bring harmony, to every system. And so that's what kind of differentiates functional medicine. And, functional medicine, we understand the mental, the physical, the spiritual. Again, that's all related. And you can't treat one without treating the other. And if something is off physically, it's going to affect you emotionally, mentally, spiritually. If something is off emotionally or mentally, it's going to have a deep effect on you physically. So again, we treat the person holistically in all those aspects as well.
You guys are really going into all the aspects because I think a lot of the diseases that are really plaguing like our society right now are directly linked to just, stress and anxiety and depression and, trying to just keep up with all the things. And it's so good that we have, people like you that are really interested into diving deep into the root causes of all these things and really also helping us understand that it's all linked together. Because I think that a lot of people may see, aesthetics or functional medicine, one, not knowing what that really means, but also associating it with just Botox and fillers. And I know that you do Botox and fillers, but you gave us a little bit of, of background, and I would love to share this with the audience. So we have Botox and fillers, which is something that, as you described, are really just like the great accessories to a beautiful outfit. And can you give us a little bit of the history behind Botox and fillers?
Yes, I absolutely can, Veronica. But can I just quickly circle back to something you said? Because something you said was right on point when you said that we live, in a world of high stress. And you feel and you notice that high stress can have effects on, people's physical well-being. And you're absolutely correct, because just to connect that to the physical. So high stress creates your cortisol levels to rise. That's your stress hormone. When your cortisol level rises, that causes inflammation throughout your whole body that affects every system. That inflammation then can lead to metabolic dysregulation, slowing of metabolism, dysregulation of your thyroid, etc. So just that cascade. So what you said is 100% true, that stress does have a real, and it's not a secret, it's a real cascade effect physically, physiologically on a person. So, you can't, if unless you can correct the stress factor, you're never going to be able to regulate what's going on in the person physically. So that's how it's all connected. So you're right on there.
Okay,
Uh,
good. Good, good. And then, so I'm happy that we're making that correlation. So
yeah,
ladies and gentlemen, you're not just, thinking that maybe stress is aging you. It actually is. So let's get it
yeah,
together and learn how to manage. But then also there are some aesthetic procedures and now even more functional medicine treatments that we can do to help us through this journey. Kind of coming back to the Botox and fillers, that's usually what we associate aesthetic, medicine and all of that with, right? And you gave us a few little stories about where that really originates and what these treatments were actually made for. And I found it to be so interesting and something that I've never heard before. So could you give us a little bit of the background between
yeah.
Botox and fillers?
Sure. So neuromodulators, Botox is the brand name of one of them, but we have Botox, Dysport, Oxy, and Xeomin, and they're all FDA approved neuromodulators here in the States. Neuromodulators or neurotoxins have been around for decades upon decades upon decades, and they originally came to the market for very real and significant uses in within the medical community. The aesthetics effects of Botox was actually found out by accident, really. So the origin of how Botox came to us as an aesthetic treatment, as an anti-aging treatment, was a practice of neurosurgeons who, for decades, had been treating patients with strokes, traumatic injury, Bell's palsy, different conditions where half of their face they lost the muscle movement, they lost the muscle tone. So they were treating that half of the face with the Botox to help bring back symmetry to the person's face. And then they noticed over years of just treating half a person's face that the side that they were treating with the Botox, because it was Botox that they were using, wasn't aging like the untreated side. It didn't have the lines, it didn't have the wrinkles. So what they did, those very, curious and innovative neurosurgeons, is they started treating patients, excuse me, the staff within their medical office, treating them to see, what was happening if we were using this product on someone who was typical. What would happen if we treated, the face, both sides? And that's how we came to find Botox for its aesthetic anti-aging purposes. So I think that's brings circles us back to the fact that aesthetics. We're lucky when we work in aesthetics because we work with well patients. Predominantly work with healthy patients who want to see us. They're choosing to come see us. They're doing everything they do is uh, an elective surgery. And we're used to delivering good news because we're delivering good results and we're helping people feel good and look good. So it's always though important to remember that aesthetics is a field of medicine and it should always be regarded as a field of medicine. And I think knowing the origins helps us bring some of that like respect and keep the aesthetic industry elevated.
Yes, absolutely. And I also wanted you to kind of go over what fillers are really like now with all the new regenerative treatments that there are like Sculptra. How are you using those types of treatments plus, the fillers to
Okay, yeah.
create, what your clients or your patients are really looking for and what are the differences?
So the bioregenerative products that I use in my practice, and two of the biggest ones that we have in the states are Radius and Sculpture. And what they do, which is phenomenal, is they actually reprogram the tissue to function more youthful. They help to regenerate new tissue um, in whatever, like Sculpture helps create new tissue, new elastin, new collagen. If it's injected deep on the bone, it helps to create, thicken the periosteum as we lose bone mass as we age. Same with radius. So they're wonderful products where, you're not only helping your patients, look better and feel better, you're actually helping their tissue to really reverse age. It's a Cinderella story. You're turning back, the biological clock, and you're helping their tissue to function more youthful. So, in my practice, I really like to focus on the regenerative aesthetic treatments that we have out there. Once we hit, our 30s, we all start losing collagen. We all start losing elastin. The fat pads in our face start to atrophy. We start to lose bone mass in our skull. So, by using these bioregenerative products, we are turning back the hand of time. We're helping create new bone mass that's been lost. We're helping to, revolumize tissue that has lost volume through the natural aging process. So you're creating a very strong, healthy foundation for your patients. So they're not only looking younger, their skin, their tissue is actually functioning more younger. And like I said, with filler, I love filler. Obviously, I wasn't born with these lips, right? So I think, I think filler, I view filler as like an accessory. I think your bioregenerative products, like your radio frequency, your microneedling, your sculpture, your radius, those are the foundations. That's you. If you're going to build a beautiful home, you have to have a really strong, you have to have a good basement, right? You have to have a strong foundation. Like that's not the sexy part of the house, but that's really the most important part of the house. If you don't have a strong foundation, no matter how beautiful what you build, it's not going to be sustainable. So I always equate it like filler, like an accessory, your sculpture, your radius, your laser treatments, that's like your outfit. Like for me, I could go out in jeans and like a tight white t-shirt every day of the week.
Hmm.
And then I just dress it up with jewelry, dress it up with a great handbag, different jewelry. That's what I think filler is. It's like your accessory. Like I wasn't born with these lips, but I wanted them.
Yeah.
Okay. So I created them. You might not have been born with these, naturally high cheekbones, but you want some. Okay. We can create them. And that's where we can have a lot of fun with filler. And that's why it's extremely important to understand where your patient is on his or her beauty journey and understand that we're all on our own individual beauty journey. And like I tell my patients, wherever you are on your beauty journey is perfect. That's where you should be. I'll meet you there.
Yeah.
I'll meet you there. It's my job to understand what you want to see when you look in the mirror. What I think, that's not important. It's what you think, what you want to see when you look in the mirror. And then I just have the tools. I have the toolbox. I have the skills. I have the ability to help you realize what you want to see when you look in the mirror.
I love that. And, I use
Yeah.
that analogy about the foundation in every aspect of my life. Seriously, girl, like on everything.
Yeah.
And I'm just happy that you brought it, to light in situations like this. So for, the women that are really looking to be younger, that deep understanding. It starts from within, before we start going into these other things, because I think a lot of us fall into just having that quick instant result, and we forget that there's maybe other underlying causes for what we're looking like, feeling like, and all of that. So I'm happy that you brought and broke all of that down. And I love the analogy that you have about saying fillers and all of that is really just a great accessory, because the way that you explain it, it's totally true. If I want a little bit of a cheekbone, I can go and get it. But
Yeah.
Sculptra and microneedling is really going to get that foundation ready for all of those things, especially for my girlies who are, there's still a lot of girls that are not into the fillers, are not into the Botox. So it's so cool to know that there are other options before you get to that point.
And what's great is like you may never get to that point, which is
Yeah.
awesome, right? Because
Yeah.
again, like as long as your home is the most important house, your body is the most important home you will ever live in,
Mhm.
right? So as long as you're treating it with love and respect and dignity,
Mhm.
then more power to you wherever you are on your journey. I have some clients that patients that I've been seeing for years, and all they'll ever want to do is just a little Botox here. That's fine. Other
Yeah.
things don't bother them. So, which is like my own personal journey, which is
Yeah.
great, right? But, so it's wonderful without judgment. We as men and women should just celebrate people taking care of themselves. And, a healthy sense of vanity is a good thing, but
Yeah.
because that keeps you wanting to keep your body healthy and strong. And, Veronica, you mentioned that, a lot of the changes we see physically outside in the aging process are due to what's going on internally, which is true. And that's where, as functional medicine providers, we can really help you understand internally the aging process. And through functional medicine, we can reverse age related changes. We can slow down the aging processes. Like, I'm sure you've heard the word like biohacking, which is true. It's about really understanding at a deep physiological level how the body's aged, what we can do through supplementation, through gut health, through peptide therapy, through bioidentical hormone replacement, how we can not only slow down the aging process, but we can reverse the aging process. Because a lot of, a lot of the changes we see on the outside, they're due to issues that are going on the inside.
So, and what are some of, because I'm sure you see all kinds of cases, girl. I can just imagine what your practice looks like. But what are some of the things that you're seeing, like your patients coming in and you're like, oh gosh, that was like a quick fix that didn't quite go as planned. What are some of these treatments that you're seeing, and how is there reversing of these treatments? How do you approach a patient or a client that comes in with a quick fix?
So one of the things you'll also learn in functional medicine, and what we make, what we make clear with our patients, and even in like regenerative aesthetic medicine, is there is no quick fix. It's not about just taking a pill and thinking, you know, if you want to just take a pill and mask a symptom, then that's a quick fix, but not in the long run. But there is really not a quick fix when it comes to the type of medicine we practice. And we let our patients know that, because the relationship that you have with your functional medicine provider, with your regenerative aesthetic provider, it's going to be a different relationship than you probably have with your PC, or even just the nurse who gives you Botox, at the salon. It's a very intimate, it's a very collaborative relationship. You as the patient, it requires a lot of you as the patient, because through understanding of what's going on inside your body within the systems, any dysregulation, you as the patient, you also need to be committed to correcting that, to fixing that, to healing that. So, when we see our patients, they'll be our patients for life, because you might come to me as, a perimenopause woman in your mid 30s, and you're just starting to see some age related changes. You're just starting to maybe see you can't eat anything you want, you're gaining weight, you're not, you're more tired, you're fatigued, you don't have the libido that say you used to have. So um, you know, we will work with people for decades. It becomes a real collaborative, intimate relationship, because as you're aging and changing, different things are going on within your body internally and externally. So we're constantly reevaluating where you are at. We're constantly reevaluating, the supplements that you're taking, the aesthetic treatments that we're doing, and changing those as as you age, as you change, if that makes sense. So unfortunately, like, there is no quick quick fix.
Okay.
Of course, come in for a little Botox, and that's easy, and that's a quick, you're out the door. But when it really comes to your health, your wellness, your vitality, your vibrancy, and longevity, it becomes a lifestyle.
Yeah, I can totally see that. So you're not seeing a lot of like, patients coming in that are like overfilled or over Botox. So you're like, okay, we need to pump the brakes and really see what's going on.
I honestly, not so much. In Boston, it's a very conservative area. So, of course, are there overfilled people? Is there work that I don't think is great? Yes, of course. But again, I have to bring that back to, you know, the person's own vision of what they want to see.
Mhm.
Um, I am never one to pass judgment on how somebody wants to look. Just me personally. I have had people on like this is a personal antidote. I have had people unsolicited randomly come up to me and tell me my lips are overfilled and that I need to dissolve them, which is like, okay, I mean, God bless you. Like, and and then I won't, then you don't have to have them. Like, you know what I mean?
Yeah.
Like don't get your lips to look like mine. So I do, I'm very clear with my um, patients. If someone comes in and they want if we've been doing their cheeks and they want their cheeks done, or they think they need more Botox, and I don't think they do. My patients trust my opinion, and I'll say, oh, it's not time to do your cheeks yet.
Okay.
They still look great. Let's revisit this in 3 months when you come for your Botox. When you come for your Botox or your Dysport appointment, or your lips look fabulous. We don't need to add our, oh right, you're right, yeah, you know what, maybe we just need to add a little bit on the top. So I think it's really about having an honest relationship with
Mhm.
your patients. And honestly, it can't be one based on, like, I'm not a saleswoman.
Mhm.
That's I'm not a saleswoman. I'm not interested in selling you, 6 syringes of filler. If just I'm not. That's not my. I'm not interested in being a saleswoman. I'm interested in developing an honest, intimate relationship with you based on understanding your goals, your healthcare goals, your wellness goals, your beauty goals, and then us achieving them together. And if I turn away someone for filler or turn away someone for Botox, then that's okay with me, because
Yeah.
I feel like um, that is the right thing to do.
Yeah. Yeah. I appreciate that. And I think that, I mean, I personally have been with, a doctor that injects me and does my treatments on my face. And I appreciate that so much from her, specifically too, because I can go in there, us women, and I can only speak for myself, but there's sometimes I'm having it and I'm like, let me see if she has an opening so I can just get in and make myself feel better. But there will be, times where I've gone in and she's like, you don't need that. So, it's really comforting to know that there are other people out there still looking for the patient's well-being and all of those things. And so, you seem to be very much like, I want to know what's next. I want to keep educating. I want to be better. I want to do and bring the best to my patients as possible. So when you're doing all of that in your research currently, what are some of the new treatments that you're seeing that you're super excited about, that you're, can't wait to see the overall results that you're wanting to incorporate into your practice?
So I'm really lucky to be involved in the American Academy of Anti-Aging Medicine. So it's a postgraduate organization. It's a postgraduate functional medicine organization um, that is an incredible wealth of knowledge, that has phenomenal conferences, classes, lectures. It's a global organization. It's really the leader in anti-aging medicine and functional medicine. So um, I'm in their fellowship program right now, which is it's a postgraduate study program where you really you learn about each of the body systems: respiratory, cardiovascular, neurological, endocrine, etc. At a really deep level, how they all interact together, and then how, as functional medicine providers, the things that we can offer to them. From a functional medicine perspective, I'm sure you've heard, like gut microbiome, gut brain access. That's kind of what is hot right now. It has come to our attention that there is a deep connection between the gut and the brain, between your gut health and your mental health. Now we know that the majority of our hormones including serotonin and dopamine, are happy hormones, are wellness hormones. They're made in the gut. They're actually not made in the brain. They're made in the gut and then they travel to the brain. So, your gut health has a huge impact on your overall physical, mental, and emotional health. So that's, kind of really big right now, understanding the gut, understanding the gut microbiome and how to correct that and balance that for overall, health and wellness.
Right.
From an aesthetic point of view, I'm really excited because I feel like there's a renaissance and there's a resurgence in our regenerative um, aspect of aesthetic medicine. So products like sculpture, treatments like microneedling, radio frequency skin tightening, the products that are actually going to help regenerate, new tissue. Those are really making a renaissance and a resurgence right now. So I'm really excited about that. But I will tell you that when you're depressed, seriously, Veronica, nothing feels better than a needle in the face. So I will.
Girl. Yeah, it totally does. Like, let me just, I mean, sometimes
Yes.
if I can't get in, I'm like, let's slap on extra lip plumper today until I can get in. And I mean, it is. I don't know if it's like, if I'm just like a glutton for pain. I mean, but for me, like that doesn't even hurt. Like for me, it's like, oh, it just feels so good, because I know I'm doing something good for myself. And
I'm right there with you.
yeah, and most recently, I just started doing the Morpheus treatments, which is not for the faint of heart.
I, l- so we have the Morpheus, and there's a lot of. I feel like the Morpheus is a hot topic right now. I
Mhm.
know there's, some plastic surgeons and people saying out there, don't use the Morpheus. It, breaks down fat in the face. People have gotten, bad results from Morpheus. And again, it's like any modality out there, any product, any treatment, any procedure, you as the consumer do your work. It's really important that you go to a skilled and educated provider. There can be negative outcomes with anything. Personally, I love the Morpheus. I have gotten amazing results with it on both the face and
And
the
the
body.
neck, the
Yes, I mean,
décolleté.
girl, your stomach, the front of your thighs, the back of your thighs.
Mhm.
I mean, just because, again, everyone in the body, you have remodeling of tissue, you have age related changes to
Good.
all the skin. So, actually, I just over the weekend just Morpheus the front of both of my thighs because I was like, I am not having old lady saggy knees.
No.
No way. I'm like, I love the Morpheus. I love radio frequency is a very old modality. It has been around for a very long time. It is proven to tighten the skin. I think combining it with microneedling has been great. It has been served the patients well in my practice. Again, you just have to make sure that the clinician you're going to knows what they're doing, and
Yeah.
knows that even with the Morpheus, your treatment that Veronica, is going to be different than the treatment I get. So again, your clinician shouldn't be following a handbook. They should be skilled enough to know how to individualize your settings, your treatment, your depth, your energy for you. Mine will be different for me. It will be different for different parts of our body. So again, if there are adverse reactions, I think that more goes back to, you know, who was driving the car. My
Yeah.
car is not going to get in an accident on its own. It's not the car's fault. It's my fault.
Also
So I
my
think
fault.
same things when you can see bad results with, filler, bad results with neuromodulators, outcomes with the Morpheus or other laser machines. It's not the filler's problem. It's
Mhm.
not the Botox's fault. It's not the Morpheus didn't do anything. It's who was operating it, who was injecting you. I think again that goes back to really understanding that this field of medicine, aesthetic medicine, is a field of medicine,
Yeah.
and it should be treated as such, and it should be regulated as such. And unfortunately, within aesthetic medicine, there's not really like a standard of like a care. There's really not like a standard of like education that different providers have to have. So it can be confusing for the patient and the consumer. So that's why I think it's really important for you as the patient and the consumer to do your due diligence. And, you could interview a couple aesthetic providers before you choose one for you. I think, I always tell my clients, because I work in, collaboration with plastic surgeons, because I understand that, at a certain point for my patients to achieve their goals, they're going to, if they want to, they'll be transitioned to surgery.
Yeah.
So I have quite a few plastic surgeons. They're all incredible that I work with. And I'll give my patients a few names of, a few names, and I'll say, go talk to all of them, because they're all, you're going to need to see the one that you vibe with, that you connect with, the surgeon who, understands your vision. So it's the same thing when, clients come and patients come to see us. It's really important that, that they connect with us, and that we understand their vision. And I want them to ask me questions about my education, where I went to school, my training.
And I think there's
Yeah.
also, as much as like we put our trust into the medical professionals, I think what a lot of people kind of miss, and this is going back to the quick fix thing. Like if I'm going to go in for these like Morpheus treatments, this microneedling, there still has to be a part of me that is doing all the aftercare, like
Yes.
especially for somebody like when I was interviewing people for the Morpheus, I wanted to make sure that they knew about hyperpigmentation and what we're going to do to, hopefully prevent that stuff. But then because I did have those questions, then my doctor was really, really adamant about wearing SPF 24/7, So I also think like as much as we trust you guys, we have to also follow the rules because you can give a great treatment. But if I go to Florida tomorrow after getting a treatment done, then the hyperpigmentation is going to be there, even if they did use the right modality and frequency and all of that. So we have to also take responsibility for what we're doing before and after these
Yes,
treatments.
100%,
Yeah.
100%, because most the aftercare, your post care, especially after, and, minimally invasive treatments like the Morpheus, what you do as the patient post treatment is going to have a huge impact on the quality of your healing and the results that you're going to get. So, being a compliant patient, which I get it's hard because sometimes I'm not a compliant patient. It's always, but being compliant, that's the best thing you can do to achieve positive outcomes, whether it's through functional medicine, whether it's through aesthetic medicine, any type of, medical procedure. And I understand that because I'm a patient of all these procedures as well. And sure, sometimes it's hard to it's hard to do it, but you have to do the post care. You're
Yeah.
100%
It's
right. Yes.
protecting the investment. That's what I say. I'm like, we're just protecting
Yes.
the investment. That's all.
Yes.
And
Absolutely.
and going back to the functional medicine, what
Mhm.
are the things, what can we be doing on a daily basis to support our internal health and support our system for slower
I
aging?
mean, I think the things that you can do, just if you the things that you can do, obviously, sleep. Sleep is vitally important. Sleep is when the body slows down, and that's when most of your wound healing, most of your healing occurs. So I know we live in a 24/7 fast-paced society. But honest, if you could get 9 hours of sleep a night, please do
Do
it.
it.
Drinking obviously a lot of water, eating a anti-inflammatory diet. We live in such a toxic world full of factors that cause endocrine disruption, that cause inflammation throughout our body. So just us as a consumer, eating an anti-inflammatory diet, a diet, rich in fruits of all different colors, vegetables of all different colors, probiotics, so yogurts, kefirs, fermented foods, kombuchas, staying away from artificial colors, artificial dyes, because we know those have a direct result on our nervous system. We know those disrupt our gut microbiome. So, you know, walking every day, exercising, meditating, just, relaxing, trying not to hold on to thoughts and just letting them flow through you. I mean, those mindfulness things, those all have a huge impact on our, physiological well-being. So those are just all things that, you can do in your daily life. But if you're interested in really understanding at a deep, deep, deep level where your body is at physiologically, how your systems are running, and how to optimize your aging process, then that would be where you'd want to see a functional medicine provider because we do lots of blood tests, spit tests, fecal tests. I mean, we are testing everything to see where your body is at currently
Mhm.
and then how we can, help your body achieve balance and homeostasis.
It's beautiful. So
Yeah.
for everybody that's listening to this, we know all the things we need to do.
Yeah.
We know that we need to meditate. We know we need to drink more water. We know that we need to practice mindfulness, all of these things. But if keeping yourself young is the push that you need to finally incorporate and have enough discipline to have these things in your daily life, then let it be that. So for everybody, we can be doing all of these things. And I know here in Illinois, there's a restaurant called True Food Kitchen, which is their whole basis of their menu is anti-inflammatory diets. And it had all the things that you're talking about, like all the roots, all the veggies, all
Yep.
the
Yeah.
fruits and all of that stuff. So the resources are there. And plus, we now live in an era that everything that we want to know about is in the palm of our hands. So we have no excuses. And you're hearing it here from the professional herself. And she's telling you this is what we need to do to help support our systems in conjunction with going to a specialist like her, if this is really what you're trying to do. So, Christine, thank you so much. Thank you so much. I feel like me and you can go on and on and on, and we can just keep diving deeper and deeper into regenerative, medicine and functional medicine. I just find that to be such an interesting topic and definitely where we're going to now. I hear more people trying to go into the holistic way rather than just putting a Band-Aid on their symptoms. So
Yeah.
yeah, so this was an incredible discussion with you, Christine, and we have learned so much about the power of regenerative medicine, the art of and science behind the aesthetic treatments, and how we can all do better and take better care of our overall skin. Thank you so much for joining us. This was an incredible discussion with Christine McMacken. We learned so much about the power of regenerative medicine and the art and science behind aesthetic treatments and how we can all take better care of our skin and overall health. Thank you, Christine, for sharing your expertise with us today. A big thank you to our sponsor, G Skin and Beauty Institute, for supporting this podcast and helping the future beauty professionals to turn their passion into a career. If you love this episode, don't forget to subscribe, leave a review, and follow us on social media for more beauty insights. And until next time, stay confident, stay radiant, and keep learning.